Hi everyone, it's Dr. Oteri-Tsague here. So today we're going to be talking about how to spot a suspicious skin lesion in the lower extremity. Now, when we think about benign or malignant skin lesions, we rarely think about the lower extremity. But yes, it is possible to find them in the lower extremities and even in our toenails. Some examples of benign skin lesions include a dermatofibroma, nevi or a mole, pyogenic granuloma. This is commonly seen in the toenail from a chronic ingrown toenail. There is also angioma or hemangiomas and skin tags. Now, some examples of malignant skin lesions that are found in the lower extremity include sublingual melanoma, squamous cell carcinoma, basal cell carcinoma, and Kaposi sarcoma. So recently, a patient came into the clinic and she was complaining of a painful lesion on the lateral or the outside aspect of her ankle. She said that she'd had the lesion for months, but recently it started growing in size. It started getting more painful and the color got darker. So that warranted a biopsy. Thankfully, so we resected the lesion and sent it up to the lab, and thankfully it did come back negative or benign, and it came back as a dermatofibroma. Patient's information is already whited out. But so today we're going to be talking about a mnemonic to help you determine if a lesion is suspicious or not. Okay, so the mnemonic is very easy. It's ABCDE, literally, right? We use this a lot in medical school. It helps us to clinically differentiate a benign versus a malignant lesion, all right? So I'm going to go over each letter and let you know what it stands for. A stands for asymmetrical. If the lesion is asymmetrical, if it's not uniform, then it's most likely malignant or a suspicious lesion. What you can do is create like an imaginary line in between the lesion and compare the left side to the right side. If the right side doesn't match the left side, then it's most likely a suspicious lesion. That's A. B stands for border. If the border is well rounded, then it's most likely a benign lesion. If the border is haphazard, then it's most likely a suspicious or malignant lesion. Okay. C stands for color. If the color is uniform, one color, then it's most likely benign, meaning if the whole color is blue or the color of the lesion is just black or it's just dark brown, it's most likely a benign lesion. But if it's a combination of different colors, blue, black, darkish brown, then it's a suspicious lesion. Okay. D stands for diameter. Diameter, so if it's greater than 6 millimeters, then it's most likely a suspicious lesion. And lastly is E, evolving. If the lesion changes over time, if it increases in size, if the color changes, if it starts to bleed or crossed, these are all signs of a suspicious lesion. Generally speaking, this mnemonic is very helpful to determine or differentiate a benign versus malignant clinically, but sometimes we still need to take a biopsy to confirm that it is indeed a suspicious lesion. Okay. If you're not sure, you still need to see a specialist, foot and ankle specialist or a dermatologist, because sometimes they can present in a way that it doesn't match this mnemonic, like I said, generally speaking. All right. So finally, I hope with this video you're able to understand that it is possible to find lower extremity suspicious lesions, and a very easy way to determine benign versus a suspicious lesion. I hope you like, share, and subscribe, and stay tuned for more videos like this in the future. Thank you.